In this video, I'm going to show you how to assess regional and segmental intervertebral motion of the mid-cervical spine in flexion in supine position.
Get our very own assessment ebook and mobile app. Links are in the video description.
Hi and welcome back to Physiotutors. Passive assessment of the quantity and quality of segmental intervertebral motion, also known as motion palpation, is part of the diagnostic clinical expertise of manual practitioners to guide decisions on a therapeutic strategy for patients with spinal pain. Hypomobility indicates mobilizing interventions, while hypermobility calls for a stabilizing approach. A systematic review done by Van Trijfel et al. In the year 2005 evaluated the reliability of passive segmental assessment of the cervical spine and found an overall reliability of poor to fair. For this reason, the clinical value of passive mid-cervical spine assessment is rather weak. In order to perform regional range of motion assessment for mid-cervical spine flexion of vertebrae C2 till C7, have your patient in diagonal supine lying position while the examiner stands at the head of the bench. First, fixate the arch of C2 with a key grip with your working hand and rotate the upper cervical spine via the patient's occiput until you feel resistance. The patient's head is resting on your supinated forearm and hand and is fixated in this position with your chest or shoulder. Be careful to keep the upper cervical spine in neutral position. Then your other hand fixates the spinous process of C7 into ventrocaudal direction with the back of your hand supported on the bench where it remains during the movement. Now perform a maximal homonymous 3D movement with your working hand and shoulder with equal components of flexion, ipsilateral, lateral flexion and ipsilateral rotation. This is best accomplished by the examiner moving his knees from flexion to extension. This movement causes maximal opening of the facet joints of C2 till C7 on the contralateral side. The whole movement is judged on resistance during motion and at end range of motion, as well as possible pain provocation compared to the other side. In order to continue with segmental assessment, first rotate the upper cervical spine with fixation on C2 until you feel resistance again. To test segmental motion of C2 C3, your working hand stays on the arch of C2 and your fixating hand is now placed on the arch of C3 with a key grip into ventrocaudal direction. Then perform a maximal homonymous 3D movement with equal components of flexion, ipsilateral, lateral flexion and ipsilateral rotation again. Again, make a coupled movement between your forearm and shoulder and extend your knees. To test each component of intervertebral motion, slightly move out of the end range and now test flexion between C2 and C3 by moving C2 into further flexion. To assess rotation, rotate C2 to the side to be tested between your forearm and shoulder. And for the lateral flexion component, keep C3 fixated and move C2 laterally by moving your body sideways. Each component is judged on resistance during motion and feel, as well as possible pain provocation compared to the segment above or below. In order to test the lower segments, move your fixating hand down on C4 with your working hand on the contralateral arch of C3 and perform a 3D flexion movement and continue this way until you reach C7 with your fixating hand. Alright, this was our video on intervertebral motion assessment of the mid-cervical spine in flexion in supine position. If you want to learn how to assess intervertebral motion of the mid-cervical spine in flexion in sitting position, click on the video right next to me. At last, thank you very much for watching. Feel free to give this video a like if it was helpful to you and share it, of course. Click on the subscribe button and the little bell icon next to it in order not to miss any future episodes. This was Kai for Physiotutors. I'll see you in the next video. Bye.